this is pretty difficult to walk away from.
Why?
We work in well medicine. There's no other place that people can say, every time the door opens to the business, you invite in someone who cares, someone who's willing to give a part of themselves to a stranger. They never know the patient that they're donating for. And I've always been in awe to think that these people come and put their arm out and say, here, you can inflict discomfort on me, because needles do hurt. And I'm okay with that. And I'll be back. I'll be back in 8 weeks. And I can remember in the first part of my career thinking, if I just see him come back in 8 weeks, I know I'll be in. And now I've seen 3, almost 4 generations of people donate blood.
It's the magic of the work we do, isn't it?
Absolutely, absolutely. This is the most thrilling industry that anybody can work in. My life has been filled with knowledge from the public. I mean, they were my tour guides at that time. They told me where to take vacations, what restaurants to go to, what rivers to canoe. I loved it. Every night I would go home to my family and say, oh, a donor told me this, or a donor told me that.
When you work in this industry, you'll work around a lot of other people who'll feel the same way you do about what it feels like to do this. Talk about your colleagues and your peers.
In 43 years, I've worked with some pretty awesome people. I've worked with some very pleasant, charming, upfront, always happy people. I've worked with some people who are quiet and appear to be sullen, and their hearts are big as gold. They want to embrace that donor. They want to take care of that donor, and I've watched them do that. I've probably worked with some of the smartest people in the industry. Throughout my years. It's just awesome to see how the whole Michigan Blood family truly cares about the donors that walk through our doors.
So what's your advice to the employees who will still be here the day you walk out the door and carry forward what you started? We all stand on your shoulders.
One of the things I've always said to the staff is, when that door opens, I want you to make them feel like they came to Grandma's, because everybody goes back to Grandma's. And that's what we need to do. Every time we look at a donor, we need to embrace them by our actions, our words. I don't care how many times staff say, thank you, we appreciate you. We should all be doing the exact same thing to every single donor. And I would just say, carry on. You know how to do this. Continue to do it. Don't ever lose sight of what our jobs are all about. We don't see the patients either. We don't know who they are. But I would say to staff, close your eyes and envision the face of a child or a football player or a grandmother. That's who we're working for. That's who we're getting this product for. Somebody's out there waiting to make sure that we do a good job.
In the time you've been here, this industry, this country, healthcare, has changed dramatically, yet there's some simple truths that never change. What are those?
The need for good quality care, and I think that Michigan Blood has always enforced that in their employees. We've asked them to give good quality care. We've looked to be efficient. We've looked to be cost effective. And I think we all have to remember that. We all have to be very, very conscious of that on a daily basis.
So if you were speaking at new employee orientation, what would you say to the new employees walking in the door?
You're about to work for one of the most fantastic corporations in the state of Michigan. In the United States, I've spoken at a variety of national conferences, and I was always so proud to say I work for Michigan Blood. And it never changed, no matter where I went, no matter what people I was involved with. I was always proud to say, this is my employer. And I would say to new employees, lucky you. Look what happened to me. Look what they gave me.
How about donors? If you were to address donors, if this was a room full of donors, everybody who came in and donated the 200,000 units since you've been in Traverse City, what would be your words?
You're awesome. You're absolutely awesome. And I would hug them. I would thank them, ask them to come back, tell them they're heroes. They probably won't get their name in the paper. The community might not know what they do, but here they know what they do, and that's important.
So this community is kind of special to you too. There are all these organizations who host blood drives, hundreds of them, who are incredible too. What do you have to say to those host organizations and to the community at large?
Thank you for embracing Michigan Blood. We were new when we came here 18 years ago. They had known nothing but their previous provider, and they didn't know that there were other people in the state of Michigan that did this service. So we had to prove ourselves, and they gave us the chance to prove ourselves. They opened their doors to us, and I say thank you for believing in us, for giving us that opportunity. We're not going to fail you. We're going to continue to give good, wonderful care. We're going to take good care of the patients at the hospitals that we service.
Of all the many friends we have, there's one special buddy that we have in this community, and that's our partner, Munson Medical Center. What about them?
It's been an awesome partnership, just awesome. You know, they've opened the doors for us to have blood drives there so that we can draw their employees on work time. They believed in us, they trust us, they know that we're there for them, and they've been there for us too. I mean, in the 18 years that we've been open, we had some pretty catastrophic episodes that happened where there were large amounts of blood that needed to be delivered. And it was awesome how we all just orchestrated what we had to do, what our part of it was, and we did what we promised we would do.
When you have a partnership like that, you're proud of their success, aren't you? You
Very
feel like
much.
You're part of it.
Absolutely.
We're part of that brand, aren't we?
Absolutely, yep, yep.
So you've had time to think about, gee, I'm going to do this interview where I reflect on my career. I bet you've thought of the answer to this question. What's your favorite memory?
Kids. I used to teach about blood and blood banking in science classes, and I was invited to a third grade classroom. And when I would talk to the little ones, I would encourage them to think about good lifestyle choices so that when they were old enough, and they were 17 at that time, you could be a blood donor. And I'd talk to them about wash your hands, eat good, you know, listen to mommy and daddy. But there's one more thing that you can do for us. If you would go home and tell your mom and dad that we need them, that we need blood donors every day, and would they consider being a donor? And the kids are always happy and excited. So I came in the back door of the blood center, and they said, Sharon, there's a little boy up front that wants to talk to you. And I'm like, little boy, I wonder who this is. And I went up, and it was a little boy from the class that I had just addressed, mom in tow. And she said, do you really need me to be a blood donor? My son came home all excited, told me that you needed me, so here I am. Gift of gold. Absolutely the gift of gold.
That's a wonderful story. I bet there are crazy memories too. You can't work in amongst the public this many years and not have some crazy thing that happened. Anything that you can tell in polite company that you're willing to share?
I think one of the different things that happened up here is we wanted to reach all aspects of the communities that we service. So I sent the team to look for the Amish communities. I said, I don't know where they're at, but go drive the back roads and find them and ask them if they will support us, because I knew they were very community minded. So when I had to tell the medical director we were taking the blood bus to a farm, and we were actually parking the bus at a farm, and we were going to draw donors, she was a little taken back, but they've been wonderful, absolutely wonderful donors that we can depend on. Every 8 weeks, we return to those farms. They gather their neighbors and friends, and it works for us. It's wonderful.
So we began about saying that you know, when you embark on a career, you have a vision of maybe how it will go or what would it be like to retire. Did it go like you thought? What about when you reflect on your whole career? Did it go like you thought? Is there anything you'd change?
I wouldn't change a thing. Even, like I said before, the good, the bad, the ugly, I have learned from all of that. I would not be driven to do what I do if I had not experienced some bad episodes, because it just made me want to improve and want to lead the team to improve. I think as I reflected back, I'm in shock that Michigan Blood offered me this position and asked me to do this. I was just a nurse who cared. and here I am.
Well, we who've seen you in action are not shocked. You've done an
Thank you.
awesome job.
Thank you.
Last question. Pretend I'm not here asking you questions and somebody just turned on a camera and said, Sharon, you're retired. We want to give you a chance to address the organization, the community. It's your moment. What do you got to say?
Thank you. This is just awesome. Absolutely awesome. Blood donors are amazing. So are the staff. I've worked with and for some pretty fantastic people. Volunteers, amazing that they give their time, but mostly to the blood donors, wow. What you are doing for your community, what you're doing for healthcare today is just absolutely amazing. Don't stop what you're doing. Keep this up. Make sure you teach your children and your grandchildren. There's always a need.
Thank you for your service.
You're welcome. Thank you.